Sharps bins. There's a bit of an assumption when we first see a sharps bin that it's for illegal use of drugs. In actual fact, in today's society, there's a huge amount of medications that are taken and disposed of in these. The first ones that spring to mind would be diabetic drugs. We've come such a long way in the science that numerous drugs can be taken on the road. I've got a girlfriend who's got a really severe immune disorder, and just recently, in the last couple of months, after 13 years, she's able to take her IV drip with her and change it while she's on holidays or at the shops whenever she needs to. She has to dispose of those items in a Sharps container. I love Sharps containers design. I'll just show that to you. So Sharps containers are designed for them to be filled. It kind of can feel a bit gross carting one around in your car with a couple of syringes that you found out near the bin, but I recommend all cleaners buy a couple of dollar Sharps container and a pair of tongs. I've come across illegally used drug apparatus at the back of many of the buildings that we clean. Loading docks, children's playgrounds, the back of the Centrelink office and places like that. It's a really good idea to know how they work in the instance that you do need to use one. They've got these teeth that actually stop the syringes from coming out if you were ever to leave the lid unlocked. They're actually really hard to get off as well. This is my play syringe, so I can show you an example. I would never take the lid off, empty it out. These just get dropped to the hospital or to the chemist. Never just chuck them in the bin. So when you attend the site, needles are usually a lot smaller than this. They're usually quite skinny and thin. Very often the end of the needle will be bent over because they usually use them numerous times if they are an illegal drug user. They're not as responsible with their needles. Diabetic people are usually quite responsible with their needles, but if you do find one, they're usually about this long and very skinny. We've got some pictures for you. But the idea would be to use your tongs, pick up the needle. We don't pop it in needle first. The tendency is that it can bounce off. We actually stick it in upside down so that it's not bouncing off and penetrating us. The other thing to remember is on the end of the needle, the silver bit, you can barely see it. So when you actually go to put it in, you can't guide in with the needle end. The other end you can. If you ever do see one, and we've got some photos below for you, can be a bit confronting. However, it's really important as part of your job, and with infection control, you know what to do with them. You'll notice in the cavity between the needle and the rest of the syringe that there is usually blood in there. And that's actually what we're in danger of getting a disease from, is the person's blood in the needle. So now that you've got the needle and you've put it safely away, you can dispose of it. I've been on a cleaning site before where I've had to use a used drink bottle. I wasn't going to leave the needle there. I double gloved, got a stick or something to help me get it in. Other times I've gotten quite accustomed to them, the plastic end, no risk, no blood. I have picked them up, put them in a takeaway container, an old Chinese container and a drink bottle because it was in a playground. This is best practice, but as long as it's in an enclosed container and you can't get jabbed, you can take it to the chemist or the hospital and turn them in. So that's a Sharps container. The other thing to be mindful of on the Sharps container, it always tells you where to fill it to, which is super helpful if you are using them often.